In November of 2021, my best friend was diagnosed with cancer, and a few months later, I found myself sitting with her in a room of the newly constructed Thibodaux Regional Cancer Institute as she received her first chemotherapy treatment. At each appointment, she and other patients sat in their infusion bays near a window that overlooked concrete parking lots and busy streets. Often, people focus on the evident physical health of cancer patients and overlook the damage that the disease can have on one's mental health. Statistics show a direct relationship between the disease and mental health. Also forgotten is the toll a diagnosis can take on family members and the everyday battles healthcare professionals endure. Unlike traditional medical treatment, evidence-based design, in addition to standard treatment, addresses both the physical and mental everyday hardships that cancer patients may experience. It is a proven field that has been developed more recently and involves psychological and health outcomes. The implementation of evidence-based design into these medical spaces can give patients, their families, caregivers, and medical staff a better experience, improve mental health, and enhance treatment outcomes. The science of green spaces within medical settings continues to evolve over time, but therapeutic gardens and healing spaces have been around for thousands of years. Indigenous peoples of North America, ancient wisdom from China, and early philosophers and religious teachings from Europe all look to the spiritual nature of the land and its capacity to heal. After spending time at the Thibodaux Regional Cancer Institute, it is evident that there is a need and desire for connections to green space in the natural environment. Thibodaux Regional Cancer Institute is part of a larger Thibodaux Regional Health System that serves the growing community of Thibodaux, Louisiana, and surrounding areas. Thibodaux is located about 70 miles south of Baton Rouge in Lafourche Parish. Home to over 15,000 residents, Thibodaux is a small, historic town with new expansions and a culturally rich southern background. The Thibodaux Regional Health System is a quickly developing, medical award-winning campus. The Cancer Institute sits in the heart of the Thibodaux Regional Campus. This proposal outlines the Cancer Institute within the 68-acre Thibodaux Regional Campus and focuses on potential connections across the site. Enhancing circulation and connections at Thibodaux Regional is vital to patient and medical staff's safety and ease of access. This expanded view of the site also allows for the opportunity to propose a restorative space accessible for all patients, their families, caretakers, and medical professionals. The proposal also includes a 4-acre site enlargement of the Cancer Institute itself and its surrounding parking lots. The enlargement focuses on the implementation of a series of wellness gardens for the Cancer Institute. These new green spaces aim to provide a peaceful area for patients and their families, while also creating a separate space for healthcare workers' respite. Lastly, the enlargement addresses the poor conditions of the existing green roof balcony of the Cancer Institute. The project deliverables will include a circulation and programming master plan of the Thibodaux Regional Campus and focus on schematic design and design development of the enlargement area of the Cancer Institute. As the field is growing, more hospital settings are being constructed using evidence-based design approaches. One example is the roof gardens at Cancer Lifeline in Seattle, Washington. The gardens are separated into 3 small spaces, including a meditation garden, a celebration garden, and an earth and sky garden. At the Thea and James Stoneman Healing Garden in Boston, Massachusetts, the garden was created to accommodate users under stress and users of all abilities. Both precedent cases involved communication and opinions of staff, patients, and users of the spaces. The Thibodaux Regional Wellness Gardens should be designed with evidence-based design and the space's users in mind. The Thibodaux Regional Cancer Institute is a modern facility designed to receive natural light and promote a comforting social environment. While the interior is designed using some evidence-based theory, The exterior remains unappealing. Cancer patients have specific needs and abilities, some of which can be quite challenging and uncomfortable as they receive treatment. As landscape architects, it is within our abilities to ensure that therapeutic gardens are designed with the principles of a scientific theory, creativeness, and accessibility for all users.